Hey everyone, this is Dr. Dane with your Into Health video tip of the week. And this week we are going to talk about disc bulges and disc herniations. And what's the difference? You know, in our office, obviously as a chiropractor, I see a lot of people with back pain, a lot of people with radicular pain, meaning pain that travels down their leg, like sciatic type of a pain. And many times, I would say more often than not, that pain is emanating from a disc lesion. So what does that mean? In our spine, we have 24 vertebrae, but we have 23 shock absorbers. They're called intervertebral discs. They're between the discs. On the outside of the disc is something we call cartilage, right? There's concentric rings of cartilage. And on the inside of the disc is a jelly-like substance called a nucleus. And that nucleus is there to act as a ball bearing and a shock absorber between the vertebra to literally absorb shock, much like air in your tires. If your tires are low on air, they're not going to absorb shock very well. If your discs are degenerating or you're losing that nucleus, it's leaking out, you are not going to absorb shock as well. The other problem, when you have a disc bulge, a lot of times when the disc bulges, if it bulges out through what we call the posterior element, it will start to compress the nerve roots. Now these nerves in your lower back, they run down your leg, which is why many people who have a disc bulge or a disc herniation get sciatic pain that travels down their leg. It can happen in your neck. You can have a lower cervical disc lesion that causes a cervical nerve root to be compressed, and that will cause pain down the arms. So your discs are incredibly important to your overall health. And the thing about your disc, when you're young, your discs aren't well innervated with a lot of blood flow. So they don't have good blood flow, and the way that you keep your discs healthy is through motion. So motion is lotion when it comes to your discs. It's kind of like I always say, it's like a good piece of leather versus a bad piece of leather. A good piece of leather, you could never tear that leather in half because it's hydrated, it's tough. An old dehydrated piece of leather, you can just tear right in half. And that's generally what happens with disc problems. Most of the time people are bending forward, they're rotating, they're then lifting or pulling, and they literally tear that disc. And what happens is the material that's on the inside starts to bulge, and that bulge, it can either bulge or it can herniate, much like a jelly donut. The jelly's on the inside. If I step on the jelly donut, that jelly's going to squirt out. If it moves towards the periphery, towards the outside, we call that a bulging disc. But if it blows through that cartilage, we call that a herniation. They're extremely painful. It's something that responds really well to the care that we do in our office, trying to get that pressure off of the disc, doing decompression, laser, some of the other therapies that we do. So if you're suffering, and so many people in this country, because we have 23 discs, are suffering with either disc degeneration or disc herniation, and they're treating a structural problem chemically. In other words, they're doing injections, they're doing painkillers, they're doing anti-inflammatories, but it's not getting at the root cause of the problem. So make sure you're seeing your friendly neighborhood chiropractor to keep your disc healthy. And if you have a disc bulge or disc herniation, make sure that you consult a chiropractor, because these are issues that we see every day in our practice, and they respond great to chiropractic care. So this is Dr. Dane with your Into Health video tip of the week. We'll talk to you guys next week. And if you know somebody with a disc lesion, a disc problem, please make sure that you're sharing this video with them.